So you moved from doing comprehensive ophthalmology, and now, you still do a little bit of that, but
Right.
mostly you're doing refractive cataract surgery, refractive laser vision correction surgery. What was that transition like?
So I loved it. I mean, for me, I did not realize that such practices even existed where you could go ahead and I'd always wanted to do more refractive surgery and I always wanted to do more cataract surgery. But in my previous situation, I was kind of stuck that I could only spend so much time. I think we live in a model over here where part of it's that you only have so much time. So you have to decide how much are you going to delegate to other people or not. And we live in a practice model where we try to have everyone work to their highest level of their ability. So an optometrist will go ahead and do as much as they can do. We as surgeons kind of try to do mostly in the OR. And it's a model where initially it took a little bit of time because you have to start trusting other people. I was used to doing all of my post-op visits. Now I'm trusting someone else to handle my post-operative care. So it's not something you can take very lightly. I mean, it's something that does take some period of adjustment, but I think most of us love being in the OR. I mean, we love doing procedures and things of that nature. So it's something that if you have the situation where you've got the right individuals, the right infrastructure set up, and I don't think it's easy to get to that stage, but we've been fortunate that we've got this great setup now where we can go ahead and do the things that we truly enjoy doing.
It truly is an almost one-of-a-kind setup. I mean, I think the traditional ophthalmologist is probably, let's say they work in 4.5, 5 days a week. They're probably in clinic 4 days of the week.
Yes.
And maybe they have one half day of surgery a week. And that's, I think, people who are in a good situation. Some have one half day of surgery maybe every 2 weeks or, maybe every 3 weeks. We're in a situation where we have surgery every single day, whether that's doing cataract surgery, doing refractive laser vision correction surgery, and sometimes both in the same day. So it's really just a unique setup where the surgeons are operating most of the time and everyone is really working up to the highest level of their capability. And it really has been a pleasure to be in that environment and just see how efficiently things can be, how exquisite the care can be delivered when everyone is kind of, operating at the highest level.
Yeah, and I think the key thing is ultimately our patients are relying upon us. And we never want the patients to feel like they're not getting proper care. I mean, you have to kind of make them understand that we're working as a team. I'm always available if needed, but my team members are someone that can go ahead and give you the great care that you need and get you where to be. And I think it's one of those things that if you are going to do high volume, you ultimately have to create systems in place where you can go ahead and rely upon other individuals and rely upon what their exams are, what their postoperative care is, stuff like that. But always be there if needed. And a lot of it is education. You take it for granted, but education and communication is probably the second big factor, is trying to make sure that everyone kind of understands where we are in this whole spectrum of things.
How long did you feel it took for co-managing optometrists or referring physicians to become comfortable with you, a new provider, a new physician, a new ophthalmologist, transitioning from your first practice to where you are now?
Yeah, so I would say that, what's special about the environment we are in is that we don't really try to push particular doctors, but we more basically advertise or market the system itself. So where we do LASIK is Clear Choice LASIK Eye Center. And when you come to Clear Choice LASIK Eye Center, you won't really see that, do you want surgery by Bafna? Do you want surgery by G, Bafna, Wiley, whatever? But it's more, what day of the week would you like a procedure done? It's assumed that the surgeon themselves are competent and will be good at what they're doing. Now, if a patient comes in with a specific demand that I want to have Bafna or I want to have Wiley or something like that, then obviously we're going to go ahead and respect their demands. But creating that system in place works really well. I would say as far as the external optometry are concerned, obviously when you come in, everyone has been used to Bill Wiley and everyone has to do that. And you have to kind of go around, build relationships. A lot of it's not just being good at what you do, but building those relationships, meeting up with doctors, them seeing your skill set, understanding how you're doing. And I will say for myself, I don't think that I probably could have joined this type of practice right out of my fellowship. I have to be completely looking at myself objectively. I don't think my skill set was there. Probably within 3 to 4 years, I probably would have been there and I could have done that. But it's something that you have to understand who you are and truly look at yourself and try to understand can I do what's out there? Because it's not, something that's right for every single person. When you get to that point, obviously it works really well. But again, every system is set up differently depending upon where you're practicing. There's no like right or wrong. To me, if someone enjoys doing everything, more power to them. They should love doing that. We just happen to be in a situation where we're much more procedural based. And so that's where we end up spending most of our time.